It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Good morning, I'm Grace Sells, and welcome back for another edition of Best Docs Network, the show featuring some of the best doctors in the Houston area that are changing lives. Up first, we have ear, nose, and throat specialist, Dr. C.T. Nguyen.
I was experiencing a sinus, like an ongoing sinus infection for like the past 2 years. I was feeling congestion in my nose and ears and throat, fever, body aches, headache.
Alondra can't breathe through her nose. She feels pressure in her face, her ears, and most importantly, she had this constant postnasal drip that make her cough all the time.
Constant feeling like you're tired. You know, you're feeling like you've got to go to work, but you feel not 100%. And it would also affect my social life because I was always so tired out of feeling sick that I would just decide to just stay in and not really go out.
Upon examination, I noticed that her nasal cavity and sinus are completely blocked. She can't breathe through her nose, and decided upon a plan of treatment that consists obviously of allergy avoidance and allergy control combined with a turbinate coblation. It's a technology using radio frequency to reduce the swelling on the side wall of her nose, increasing her capacity to breathe through her nose and improving her nasal allergy symptoms.
After the procedure, I no longer experienced the symptoms that I was experiencing before. I noticed that I could breathe a lot better, like I just want to say I could breathe.
Alondra was very happy with the result of the treatment. We actually found the cause of the problem and targeted our treatment. Alondra breathed better, she feels better. It's a new person. Medicine has advanced so much that there's always a solution to breathe well and live well. Patient doesn't have to suffer anymore.
I no longer felt congestion. I wasn't getting sick every month because I no longer had that infection inside of like my sinus passages. So I want to say I feel great now.
Jack from Tomball has a question for Dr. Annie. How can airplane travel cause clots and death?
Long travel can cause venous flow to decrease, so therefore the flow in the legs can kind of pool and accumulate and not come back up to the heart. When that happens after patients are sitting for long periods on an airplane, clot can form because the blood becomes stagnant. To prevent that, we tell patients to walk the aisles of the plane, exercise the legs even while sitting, and try to stand up intermittently throughout the flight. This will protect the patient from having clot formation. What happens when the clot forms is when the patient finally leaves the airplane and gets to their destination, clot can move and go up to the lungs and cause sudden death from a pulmonary embolus. Very critical to know about clot formation, very critical to prevent it, and easy to prevent by just moving. Actually, sometimes wearing hose will help, and knowing the risk factors of flying can prevent a problem when you get to your destination.
My legs were very, very tired. I couldn't sleep, toss and turn, couldn't get comfortable, they would just hurt, and all night for years.
Restless legs is best described as a very strong sensation or urge to move your legs. It becomes disabling because it creates an anxious sensation. It's hard to explain. You're not sure what's causing it. You just have this overwhelming urge to move your legs. It almost always occurs at night, and because of that, it creates severe insomnia and severe anxiety.
I had varicose veins. I knew I could see them on the outside. I didn't know about the veins on the inside that were not allowing the blood flow to go past my knees. That would just go up so far and then just go back down to my feet.
We mapped her veins very carefully using ultrasound. We again isolated all the bad veins, the ones that were too large and the blood was running backwards because the valves had failed. And then we selectively ablated those using radiofrequency under ultrasound guidance.
No pain, just a little stinging when they first go in with it, but really not much, even though they say, well, it's not gonna hurt, it's not gonna hurt, but it really didn't. The last treatment I had, I didn't feel a thing.
And we do that without any incisions or anesthesia. The patients can walk in, sit down, have the procedures done, stand up, walk out, get in their car, and drive themselves home.
I would say don't worry about it, just do it. Just get it done because you need to have it taken care of. Sleeping now, I rest comfortably, and it turned out good.
In the past, we used surgical procedures. Problems with that: one, it required general anesthetic. Two, it required big cuts with potential side effects like infection, damage to nerves, arteries, muscle, and they weren't selective. We were almost randomly choosing veins to treat, and they weren't always the only or maybe even the correct veins to treat. Now we selectively treat only the veins that are running backwards, so it works much better.
If you've had a doctor that has changed your life, we would love to hear your story. Send us an email at info@bestdocsnetwork.com. Now let's go ahead and check out interventional cardiologist Dr. Annie Varughese.
Coronary disease is a type of vascular disease where plaque coats the inside of the vessel to the point where there's a growth, and that's called stenosis. The number one problem with regard to formation of plaque is cholesterol. So we have different types of cholesterol, LDL cholesterol. We have HDL, which is the good cholesterol, LDL being the bad. Triglycerides are another bad cholesterol. So it's very important to do advanced testing of the lipids.
Back in 2000, I went working, had some pains in the chest, went to my general practitioner. He examined me and said, you need to go see the cardiologist today. Made an appointment for me with Dr. Varughese, and when she examined me, she said, just stay right there. You're going to the hospital.
The case of Thomas Cole is quite interesting. He came at the beginning of my practice years. I've been practicing for 18 years now. And Thomas Cole came as a new patient and just complained of intermittent chest pain. We proceeded to take care of him, and he proceeded to die on the table and had no heartbeat. So we, of course, started resuscitative measures immediately and quickly transported him to the cardiac catheterization laboratory, found a severe blockage in the right coronary artery, and that's why he had become hypotensive. His blood pressure had dropped, his heart rate had slowed down to nothing, and it had stopped. So in the office, I pounded his chest and started CPR, and then we took him to the cath lab.
I was very lucky. I mean, if you're going to have that kind of thing happen, being in a cardiology office is one of the better places to be. The thing that's most amazing, I think, about Dr. Varughese is her concern for her patients and her constant drive or constant searching for things to help them, not only when they've had the heart attack, but help in prevention of the heart attack. Her personality of her patient care is phenomenal.
Brushing your teeth can prevent a stroke. People suffering from gum disease are twice as likely to have a heart attack or stroke.
I'm an athlete.
I am a World Series champion.
I'm a hockey player.
I'm a football player.
I am strong.
I am strong.
I am strong.
Fight colorectal cancer. Demands a cure for colon and rectal cancer.
I'm strong because
I have lost a friend's mother.
Because I lost both of my parents to this disease.
I am strong because nobody should suffer. Let's beat this cancer. One simple test, and you could save your life or someone you love.
Get screened.
Be a part of 1 million strong.
A hospitalist is a doctor who is practicing medicine in the hospital. In specifics of OB-GYN hospitalist, the doctor is someone who has limited their practice to obstetrics and gynecology. Mostly that's in the labor and delivery unit in support of the private attendings, helping to assure safety for the patients. So having someone on site, in-house, present, should something happen very rapidly that needs a very rapid intervention.
Hospitalists provide a safety net for patients when extraordinary situations may arise.
Hospitalists exist to support the attending physicians. They are also available for when unassigned patients without a physician at that hospital arrive. There are hospitalists that restrict their practice to the labor and delivery unit only and only participate in the childbirth process. They are called laborists, and their role with a patient who has a private provider will be determined by that patient's relationship with her private provider. But also, should that private provider have circumstances that get in the way of immediate response, the patient will know that there is a trained OB-GYN doctor in the hospital, on site, in-house. There are around 180 different programs in the United States. Houston has been very active in a leadership role geographically. We currently have 5 functioning programs, and there are other hospitals looking at the success that has been here with these programs.
Dr. Morgan's passion for patient care drives his motivation.
I became a hospitalist for the opportunity to help women, particularly under urgent and extreme circumstances. I think it's a better way of doing things in particular conditions, provides a higher level of care and safety for patients.
Let's talk about pink eye. Pink eye is an infection of the lining of the eye. It's called conjunctivitis in medical terms. And it can be caused from bacteria, in which case you need certain types of drops for your eye. And it can be caused by viruses, and that's the more common cause. Now, you can tell if it's a virus in that the lymph node right here in front of your ear will be swollen and tender. That's because it drains the eye. Now, if that lymph node is tender and swollen, that's usually a virus. So you don't need antibiotics, you don't need antibiotic eye drops, but you are contagious. Now, if you have thick, creamy, ugly pus that comes from your eyes, they're stuck together in the morning. That happened to me a lot when I was a kid. That's usually a bacteria. That little lymph node won't be swollen. You will need antibiotic eye drops, and it'll probably be contagious. Now, how long is it contagious? Well, a virus can be contagious for weeks and weeks. Bacteria is usually just a few days. Generally, once the redness starts to go away, about 12 hours later, you're no longer contagious.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
For more information on any of these great doctors, head to our website, bestdocsnetwork.com. Up next, we have cosmetic dentist Dr. Guy Lewis.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is the majority of the time a place where we can't go mosque in schools. But anyway, we went there. We followed the information, detained some personnel, and as we were leaving, there was an SV bit on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was in Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me. He's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
Carotid disease is a very important risk factor for stroke, and carotid disease develops because of plaque formation in the carotid arteries, especially near the carotid bulbs and involving the internal carotid arteries. Those are the arteries that feed the brain. So people who smoke, who have high blood pressure, have diabetes, these are all risk factors for carotid disease, and many times these go silent. So we try to evaluate our patients with carotid ultrasound, which evaluates the blood flow and the anatomy of the carotid arteries. If we find significant carotid disease, we either think of surgery or carotid stenting. Carotid stenting is an innovative way of treating a patient without cutting on them, which is very important. And many patients are good candidates for carotid stenting. Carotid stenting is done in usually university settings, especially here at the Texas Heart Institute. We have great interventional cardiologists who do this. Ask your doctor about carotid stenting if you have carotid disease. It's a great alternative to surgery.
Are you aware that you can log on to our website, bestdocsnetwork.com, and request an appointment with any of these great doctors that you've seen today? Let's go ahead and check out plastic surgeon Dr. David Altamira.
I had a double mastectomy, and they needed to round out one of the breasts with more tissue, so they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body, and she thought, I went through this trauma with the breast cancer. Now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get, what would you say, a pouch and scar tissue buildup. So, I'm gonna look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. You know, I feel sexy. You know, I can wear a bikini, where I couldn't do that since 4 children ago. So, you know, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, you know, wanted to get back to me. I got my sexy back.
Today we're here with Dr. Reynolds Delgado at the Texas Heart Institute. He's the Director of Cardiac Transplantation at the Texas Heart, and we're so happy to have him with us. Dr. Delgado, thank you for being with us today.
Well, thank you, Annie.
Now, we know that cardiac transplantation is something that seems so far removed from most people, but really so many people are in need of this great help. And can you tell us a little bit about how you evaluate a patient for transplant?
Yes. Well, first of all, there's a lot of people that need it, as you say. Around 6 million people in the United States have heart failure, and a good proportion of those need a transplant. The problem is we only have around 2,000 donors' hearts available to us in the nation per year. So we really have to focus on those patients who can get the most out of those 2,000 donors. And so really that's the focus when we're working somebody up for transplant, finding someone who's going to live a long, healthy life after the transplant.
Exactly. Now, there are several ways of helping the patient, right, with assist devices. Would you kind of mention those for us?
Yes, and you know, the transplants are a limited resource, so we only have that limited number that we can do per year. But there are other things we can do that are not. An example is the artificial heart devices. These are known as LVADs, or left ventricular assist devices. And these are small motors, small motor pumps that are tiny, about this big, that can be implanted with a surgery in the chest, underneath the heart, and they can pump blood for the heart. And so really in a failing heart, we have other alternatives like this.
We see that there's hope for people who can't even get a transplant, but they could come and be evaluated for even this assist device.
Absolutely, absolutely. There's so much we can do beyond transplant. And as for transplants, we do many of them. We did 57 in 2012. That's a lot of transplants. It's 1 a week. But one thing it's important for people of Houston to know is that herein, where we are standing and sitting, is the greatest med center in the world. Just right there, it's the greatest cancer hospital in the world, and here is the greatest cardiac hospital in the world. And within this med center, we can do just about anything that's doable in medicine.
That's excellent. Thank you, Dr. Delgado. We really appreciate you.
Thank you, Annie.
It is important to cover your mouth when coughing and sneezing, since a cough can reach the speed of 60 miles per hour and a sneeze can exceed the speed of 100 miles per hour.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
heart attacks in women can be very tricky. In most people, a heart attack can be signaled by squeezing, heavy, dull chest pain with sweating and shortness of breath, and the pain may radiate to the arm and the neck. In women, unfortunately, and for some reason, the symptoms of a heart attack may be completely different than what I just described. For example, a woman may just have shortness of breath with no chest pain, yet she's having a heart attack. A woman may have talk to your doctor about it.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
The need for vaginal rejuvenation isn't always talked about, but it is a common problem. Dr. Imtiaz explains why.
For a lot of women, once they've had children, they feel that sex is not the same as it used to be. They don't have control during intercourse, they don't find pleasure during intercourse, and in general, most patients would say that they feel loose. If a woman feels loose, then she has the option of having a vaginal rejuvenation done. And it's a procedure where I would reconstruct the pelvic floor muscles and also tighten the vagina in order to give her better sensation during intercourse.
Appearance can also be a cause for surgical intervention.
If a woman is concerned about aesthetically the way she looks, that surgery can also be done. As a vulva ages, you may notice wrinkling or loose skin on the outside, or some women, even as young women, notice that the shape of the external genitalia is not pleasing.
But age doesn't necessarily determine the need for vaginal rejuvenation, as young women are sometimes candidates as well.
It's not uncommon for me to see a patient who's young, maybe even in her late teens, who has labia minora that are so elongated that she's embarrassed to wear a bathing suit. And it changes their life when you can improve the appearance and give the woman a confidence that she may be needing.
Thanks to Dr. Imtiaz and her vaginal rejuvenation procedure, her patients are living a fuller, more confident life.
But vaginal rejuvenation in its true sense, it's more for tightness and function, but we can also change the way you look.
That's going to wrap up today's episode of Best Docs Network, the show that features some of the best doctors in the Houston area that are changing lives. For more information on any of these great doctors that you've seen today, and to check out hundreds of videos and more, head to our website, bestdocsnetwork.com. And if you have comments or questions, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. We'll see you next week.